hostage. I hate to watch you walk away. I hate to watch you walk away.
What's up YouTube, Adam from C1 Do 1. So I actually have a weird Thursday, Friday off during my orthopedic surgery rotation. So I'm going to use this valuable time to get caught up on some errands. I have to go do a drug test, fill out some paperwork for my next rotation, and then I actually have a school/hub meeting today at the hospital. So if you want, you can join me, and along the way I'm going to tell you a little bit about how my orthopedic surgery rotation is going. So stay tuned. So my orthopedic surgery rotation started 2.5 weeks ago. Orthopedic surgery rotation is actually hand surgery. That's the subspecialty of this rotation. And it's kind of weird because I just did family medicine, psychiatry, and now I kind of skipped general surgery 1, general surgery 2, internal medicine 1, internal medicine 2, and I jumped straight into surgery, which is a bit unusual. My schedule got messed up this year. I basically had 0 surgery experience. I've been in the OR maybe 3 times before a couple of weeks ago, and that was just when I was shadowing during clinical research and then when I worked with a spine surgeon back in Florida. So those were the only times really I had gone to an operating room. And so needless to say, it was a really, really steep learning curve. That first week really sucked, like really bad. Part of it was just that my preceptor is one of those, hardcore, you gotta know everything type of doctors, which is, I respect that, and I understand where she's coming from. But at the same time, for me, like I just finished psychiatry and then went into hand surgery. It was kind of like a really rude awakening. First day was at a surgery center. That surgery center, that preceptor basically only does carpal tunnel releases, trigger finger releases, ulnar nerve decompressions, that type of kind of, not necessarily simple, but more straightforward surgery she does at a surgery center on Monday. So on that Monday that my rotation started, so that first day I basically got pimped to know and about everything hand related. Hand innervation, muscles, bones, naming all of the bones in the hand. It's a really ugly feeling not knowing stuff. Like, I know in medicine, basically my whole life has been not knowing things and then knowing enough things to get by. It's you, the surgeon, and then maybe the scrub techs, but it's just kind of like you really put on the spot. And I'm usually good, thinking quickly on my feet, but it's different when you just don't know the information. So yeah, at one time, yes, I memorized all of the bones in the hand. At one time, yes, I memorized all of the hand innervation, all of the small muscles in the hand, and I had to memorize the brachial plexus because that was part of learning neuro, MSK, and learning muscles for the board exam. But if you just don't practice with it regularly, that surgeon deals with everything related to the hand, bones, and arms and shoulder every single day of their lives. So it's kind of tough when you just kind of get thrown into that. But I quickly adapted and realized that, oh crap, I need to actually study and be prepared for this rotation a little bit. So the first 2 days, I basically made flashcards to memorize all of the bones. I needed to learn the dorsal compartment contents, needed to learn the compartments, the contents of the carpal tunnel, and the locations of some of the nerves, and some of the big branches, and the arteries as well. And so I feel like I pretty much caught on that first week. So it's not only not knowing certain academic style anatomy questions, but it's also not being familiar with the unwritten rules, so to speak, of the operating room. Never scrubbed in before. You always have to make sure you wear a mask when you go into the operating room. You have to make sure that you know your glove size, you know what size gown you need, whether you want double gloves, whether you want specific gloves. And then there's this whole surgical dance that you have to do in order to put a gown on. They taught us that at my school. Luckily I had kind of a rough idea of how it was supposed to go. It's really not that complicated, but it's really freaky when you don't know what the heck you're doing. So I finally got the hang of that. By the second week, it felt way better. The people kind of knew me there. There was a couple of other students, nursing students there that were also learning like me, so it wasn't, all the focus wasn't just on me not knowing literally everything. I've been doing clinic 2 days a week with the doctor, and then surgery 2 days a week with the doctor. It's been really exciting though, because I've gotten to do injections. So I've done trigger point injections, I've done joint injections in the wrist, and then I also got to kind of take the lead at the beginning of one of the surgeries, where I actually was given the scalpel, asked to locate where I would make the incision, mark down where I would make the incision, and then I made the incision, did some of the blunt dissection down into the superficial to the deep tissues, and it's a lot of retracting, and yeah, it's been really crazy. I did not think I was going to get that much freedom or opportunity, I guess, to do so many things. So that was really cool, and I got to tell all of my friends and family that I got to cut my first person. To give you an idea of what the types of things that you see in orthopedic hand surgery, a lot of carpal tunnel, as you can imagine, a lot of trigger fingers where people's fingers get stuck or they click, a lot of ulnar nerve entrapment at the elbow, first CMC fusions, and a couple of carpal metacarpal fusions. A really cool surgery where when you have the CMC arthritis, you actually do a trapeziectomy to remove the trapezium here, and then because that thumb would have nothing to rest on, you have to kind of suspend it. And you suspend it using this tiny little Arthrex mini tightrope system, where you literally drill through these two bones and then use a little really strong filament to hold up the thumb. So that's probably my favorite surgery so far. If I had advice for anybody starting orthopedics or hand surgery, I would say know your anatomy, know your basic terms, know your innervation, and then know the common procedures too. And not only that, but if you can make a good clinical diagnosis when you're interviewing a patient, and you can say, I think it's, narrow it between at least 2 things, the doctors, I think, will be pretty happy. Oh yeah, and also a weird little bonus was that this doctor's husband is also a plastic surgeon, so I got to scrub in on a paniculectomy. So if you don't know what that is, look that up. I'll put a picture here. I got to scrub in on that, and that was a really bloody experience. Like, I literally got splashed in the face. My glasses were all covered in blood, and the scrub nurse had to help wipe off my face from all the blood. So that was really awesome experience. I got to suture on that one as well. A lot of heavy retracting of all of the fat removal. Another bonus was that if you do a rotation in the hospital and you're in an operating room, you meet a lot of other doctors around there. I made friends with a couple of the anesthesiologists, and I actually got to intubate a patient. That was my first intubation. Nothing super emergent or anything. I at least got to do it on a real person. I guess the anesthesiologist trusted me enough, and he's like, all right, here you go. And he handed me the tools to do it. I was like, okay. It was crazy because he basically had confidence that I could do it, but then when I'm there and I was looking down, looking for the epiglottis, and he said, okay, once I had the ET tube in there, he said, okay, be willing to bet your car that it's in the right spot. And I looked at him, I was like, what? So he's like, you need to be so sure that it's there that you can bet your car that it's in the right spot. And of course that kind of freaked me out, so I was second guessing myself, but sure enough, listened to both lungs, and then you could see the CO2 reading on the monitor, so I got my first intubation, first try. That impressed everybody. Even the surgeon said that they had never intubated a patient in their entire medical career. That was kind of cool that I got to do that in my 3rd rotation of 3rd year of medical school. If I had any advice, like I said, anatomy, know what the rotation is about, know the common clinical presentations of what the majority of the people see there, and then make friends with people. Like, I know you're not there necessarily to be your preceptor's friend, but as long as you can kind of make a good connection, you know, just be a good person, be nice, be ethical. It's expected that you're gonna feel really lost, because I still feel lost, and I've been there for like 3 weeks. That's basically how orthopedic surgery, hand surgery has been going. So I'm gonna go look for where this place is to do the drug test, and then I'll get back to you guys when I go to the meeting later. Well, good morning. Sorry I didn't get to finish this video last night because the hub meeting for our rotations here in Tucson ran really long. The hub presenters, there was 3 hub presenters talking about how the hub's going, new preceptors, as well as there was a 4th year and a residency liaison person for a school talking. So it ran until like 8:30. It was too dark, forgot to film. So now it's the following morning, and I still haven't gotten the drug test that I need. So I found out exactly which one I need last night. So I'm going to just go and do that right now. But yeah, so the hub meeting talked about a bunch of residency stuff. Kind of stressed me out, actually. They were talking to us about setting up 4th year elective rotations. And basically, for our school, the only mandatory rotation for 4th year is emergency medicine. All the other 9 or 10 rotations that we have are completely up to us. And so it kind of feels stressful because we have to get in contact with schools that have programs or standalone programs that we'd like to go basically do our residencies at. So that means knowing a specialty, knowing a region of the country, getting in contact with them, setting up audition rotations, trying to complete the application, complete CVs, personal statements, gather letters of recommendation. It's a lot of stuff. I have 1 more week left of orthopedic surgery to go, and then after that I start internal medicine outpatient, so I'll do a little video about that. Other than that, I'll talk to you guys in the next one. I'm Adam, see one, do one. Thanks for watching.